Are you struggling with penetrative sex and thinking about IVF to conceive? While IVF might seem like the perfect solution for vaginismus, there are steps that you can take to make this journey more smoother and fulfilling. In today's video, we are focusing solely on how vaginismus affects fertility, not why it causes pain or how to treat it. And if you'd like to know more about why vaginismus is becoming a significant issue in India, click the pop-up out here to watch the detailed video. Before we dive in, don't forget to subscribe to my channel and also hit the bell icon, because the only reason why I create these videos is to educate and empower you to make the right health decisions for yourself. So please like this video because it really helps spread the word. Vaginismus is a condition where the vaginal muscles tighten involuntarily, making penetration extremely painful or sometimes even impossible. So when we are talking about penetration, we are talking about, of course, sexual intercourse, gynecological examinations, and even inserting a tampon. Now naturally, this creates a significant barrier to conceiving naturally, which can be emotionally and physically overwhelming for couples. Now let's talk about why jumping straight into IVF may not always be the best idea. See, IVF is a complex process both physically and emotionally. For someone already dealing with anxiety and stress of vaginismus, IVF can make things even more harder. It often amplifies the feelings of frustration, making the journey towards pregnancy less joyful. IVF is also very expensive and doesn't really address the root cause of the problem, which is vaginismus itself. Plus, let's also not forget about the fulfillment that comes from natural conception. So if there's a chance for you to explore that path, it's worth considering. While I won't go into the detailed treatment options for vaginismus in this video, I already made a video covering this topic in depth. So you can click the pop-up out here to watch it right now. But to give you a quick overview, treatments for vaginismus include pelvic floor therapy, psychosexual counseling, vaginal trainers, and of course Botox injections. These approaches can be incredibly effective when followed up consistently. Now let's look at some scenarios to help you understand your options better. Imagine you're a newly married couple and relatively young. My advice for you will be to take things slow. Many couples with vaginismus discover other ways to find intimacy and pleasure beyond penetrative sex. And when you feel that you're ready to try for a baby, follow a step-by-step approach as advised by a doctor. Remember to be patient with yourself during this whole process, because I've seen so many patients overcome vaginismus simply by sticking to their treatments and of course not losing hope. Now it is impossible to completely evaluate a woman for fertility with vaginismus without invasive treatments. So I would say better not get into treatment if you are not going to go through with it. For older couples, however, the situation might feel a little more urgent, especially if you married late or found your partner at a later stage in life. Here it is very important to start with a full fertility evaluation. This will help you and your doctor plan your next steps. Now if vaginismus is mild, an IUI or intrauterine insemination can be a good option. If IUI is challenging, you can try IUI under anesthesia. However, keep in mind that most couples need 3 to 4 IUI attempts to conceive, so this might not be a long-term solution. A good option is to inject Botox during one of the IUIs to make your next IUI not require this anesthesia. Now, if there are additional factors like blocked fallopian tubes, fibroids, endometriosis, a laparoscopy can be very beneficial. During this process of laparoscopy, your doctor will assess your fertility, clear any issues, and also inject Botox to make your further attempts at natural conception much easier. Now, if your partner has a very low sperm count, IVF may be sometimes the best option. Thankfully, with advancements in technology, you can often avoid vaginal scans altogether during this process and offer abdominal scans instead. Now, in cases where the woman has premature ovarian failure, we sometimes combine the first IVF cycle with ovarian rejuvenation techniques like PRP or stem cells. Now, adding Botox to the treatment during the egg collection process can improve the chance of natural conception in subsequent cycles if by chance the IVF fails in the first attempt. Now, a quick note about Botox. It's not a magic cure. It's just one part of the whole solution. To see lasting results, you need to work consistently with a psychologist and also use vaginal trainers daily. It requires commitment, but the results can be life-changing. If you're navigating vaginismus and fertility struggles, know that you're not alone, and there are solutions that can help you achieve your dream of parenthood without compromising your physical or emotional well-being. Now, have you faced similar challenges or found success through particular treatments? Share your stories in the comments down below. And don't forget to like this video and subscribe for more science-backed insights into women's health. Let's tackle these tough topics together.